I'm Brent Wright. I'm the medical director of the T.J. Sampson Family Medicine Center.
My name is James Clements. I'm a third-year family medicine resident here at the clinic.
We're a resource-challenged environment. Let me explain that further. Not only are we challenged to be responsible with our own economic use and home budget, but we deal with a patient population that's very challenged. We look at patients who are trying to put meals on the table, trying to find work, trying to care for their families, trying to pay for their medications, trying to pay for their health care. When you think about being in the exam room and you see that the patient has so many social issues and so many areas that need navigation, I need some help. This is beyond what I can do in the remaining 5 minutes, 10 minutes that I have in this appointment. Not this, hey, you've really got a lot of problems. Your life's terrible. I hate it for you. Good luck with that. Here's a referral for someone who may see you in 6 weeks. We have approximately 25 people working here with staff, residents, and faculty clinicians. We service a patient load of approximately 12,000 patient visits a year, anywhere from home visits to outpatient clinical visits to hospital visits, as well as nursing home care.
I've started doing home visits because it's a service that I can offer to my patients. I chose this career because I like doing a little bit of everything. I had a patient who was always uncontrolled hypertension. If he was sitting here for an hour or two, blood pressure was always perfect. But then a lot of times it was just terrible and we couldn't understand why. And then one day one of my nurses coming back from lunch said, Mr. Such and Such we saw him walking down the road, and it turns out he was walking 11 miles to our clinic one way and then walking home 11 miles. I believe he's in his mid-70s. That's a patient that definitely qualifies. And you saw the conditions that he was living in. You got to full understanding of how he was the caregiver for his wife. I didn't realize that this patient was illiterate until I saw his pill bottles. And you saw that he had a sun or a moon drawn on the bottle, or the number 2 if he was supposed to take it twice a day.
My name is Mary Mae Hensley, and I am a community health navigator, and I assist the clients. I kind of see their problems and their needs firsthand. I'll talk to the doctors for them. I'll assist them in connecting with resources. I'll contact our community organizer, and we'll work together in getting the clients what they need. Well, sometimes it can just be as simple as going into a client's home and maybe they need rails in their bathroom, or maybe they need a hospital bed, and it's hard for the client sometimes to just come out and say, I need a bed. But when we're in their home and we notice these things, we can go back to the doctor. We just reassure them that we're there to help them. We're not there to judge them. We're just there to help, and that is what we long to do.
I am Darla Handy. I'm the community health organizer for Hart, Barron, and Metcalfe County. We work together on just making sure that basic needs are met. I'm the one that kind of goes out into the community and advocates and pulls those resources together to be able to target those specific needs, and maybe even help create resources that did not exist.
Dr. Wright's nurse, Kim Landrum, she is wonderful.
Right. I'm Kim Landrum. I'm the RN nurse manager, the care coordinator for the Family Medicine Clinic in Glasgow. We work closely with Darla and Mary Mae in helping coordinate care for our elderly patients. And they come and we talk about different cases, or if we've seen somebody during the week, I'll say, hey, we had Mr. Smith and he needs some help. Can you go see him? And they're like, sure. Because they always see stuff that maybe we don't see. We're looking at them medically and they're looking at them socially.
Right. I think what's important to understand about this model, it's really about the best care for the patient, and there needs to be a lot of good, effective handoffs that take place. I can't take care of patients in a singular manner. I don't think any physician can. And it's not that complex. I think it takes basic human skills. You've got to be committed to the overarching care of the patient. You have to work well with others. You have to understand that there are things that you just cannot do. If someone was in your office and they had abdominal pain and you felt like it was an acute abdomen, you would refer them to a surgeon. We don't think of in medicine, hey, someone has social pain. Someone has issues that they really need that team. And engaging this team allows you to have that, comprehensive approach, much like, NASCAR when that car rolls into the pits and they need tires and gas and their windshield cleaned.
Our main goal was just getting a base of patients and getting started and getting to seeing them and assessing their needs. They don't require that the office staff really do anything extra. except just keep an eye on the patients and say, you know, hey, we've got a patient that maybe would benefit from Darla and Mary May going to see him.
I think this is unique in the fact that we're actually doing it. I go to a lot of healthcare conferences where they talk about stakeholder engagement and navigation and how to follow the patient, you know, through the white space or the gray space of healthcare. You talk about patient navigation, but we're doing it. We're not just dreaming about it. We're not just hoping it can be done. It's doing it.
No, I have never seen where the different disciplines actually work with the physician's office to carry out and meet patient needs.
I feel like we have really connected them with a lot of great resources in our rural areas.
That it's talked about. It's been talked about for a long time. It's not anything new as far as the conversations go, but nobody has really tried to do it.
It keeps that patient out of the ER. So it decreases healthcare dollars. It's better for the patients, and it's better for me. I mean, this is my favorite part of my job. I really get to know these patients and love them. You really understand your patients better, and that does carry over to the clinic.
It's been a wonderful, wonderful project. The place that's been most helpful is in the home.
But I will tell you, after working in this practice and knowing this group of people, I believe now it is just a lack of resources. Not just to grow in small steps, but to be the best you can be where you're at the time. And that's what we believe flourishing is.
Over the years, we've done several studies and grants and that kind of thing, and we enjoy it. But we've really enjoyed this one. This has been our favorite. I think it's here to stay.